This sharps training provides health and safety information to prevent needle sticks and other sharps-related injuries as required by the U.S. Occupational Safety and Health Administration. This training is for individuals working with needles and other sharps and provides information on how to respond to an incident or injury involving sharps. This training complies with federal, state, and local regulations, including the Needlestick Safety and Prevention Act of 2000. This law requires the use of safer needles, needleless systems, and other medical devices designed to prevent exposure to bloodborne pathogens. It also requires institutions to maintain a sharps injury log. Safer needles include non-needle sharps or needle devices used to withdraw body fluids, administer medications, or perform research-related activities. These devices have built-in safety features. Needleless systems may prevent puncture injuries from contaminated sharps. All needle sticks on campus require medical surveillance and proper tracking. Those that have chemicals or pathogens may have serious consequences. Do not use needles unless required by an approved experimental procedure. Use safety equipment and precautions to reduce the risk of injury. Individuals using needles and sharps must participate in hands-on training and demonstrate proficiency. Supervisors must maintain training records. Individuals working with dangerous materials must receive supervised training and demonstrate mastery with a designated mentor. Remain focused when working with needles and sharps to avoid injuries. The likelihood of being pricked with a needle increases when performing repetitive tasks. Take a 20 to 30 second break at regular intervals and plan breaks every 5 to 7 repetitions. In the event of a needle stick injury, follow these steps. Step 1. Remove contaminated PPE around the injury. Step 2. Immediately encourage mild bleeding at the puncture site. Step 3. Wash exposed area with soap and water. Water helps to remove pathogens and washes contaminants away from the bloodstream. Step 4. Use sterile materials such as a pre-packaged bandage from a first aid kit to dry and cover the puncture site. Step 5. Remove all other PPE and safely exit the lab. Step 6. Seek immediate medical attention at campus health services, the nearest urgent care, or emergency room. If medical treatment is sought, please complete the workers' compensation forms required by your Human Resources Department. Workers' compensation claim forms must be completed within 48 hours. In the event of an injury that is not life-threatening or requiring urgent medical care, please contact Corvell at 800-685-2877. Corvell is a nurse triage service provided by the Arizona Department of Administration and provides telephone consultations for minor injuries. Some medications must be administered quickly after exposure. Tests may also be necessary to determine further treatment. For more information, contact Campus Health Services. After needle stick, report the incident to your supervisor and environmental health and safety. In the event of a sharps injury other than a needle stick, follow these steps. Step 1. Remove contaminated PPE around the injury. Step 2. Wash the wound with soap and water. Do not scrub excessively. If eyes, nose, or mouth are exposed, rinse with water only. Step 3. Dry and cover the wound. Use sterile materials such as prepackaged gauze from a first aid kit. Step 4. Seek immediate medical attention at Campus Health Services, the nearest urgent care, or emergency room. Some medications must be administered quickly after exposure. Tests may also be necessary to determine further treatment. For more information, contact Campus Health Services. Step 5. Report the incident to your supervisor and complete a university incident report. Step 6. Complete the workers' compensation claim forms within 48 hours. Following any sharps or needle stick injury, contact Campus Health Services or a healthcare provider for follow-up. EHS evaluates all reported sharps incidents. Safer devices or alternate procedures may be implemented after sharps incidents are reviewed. Recapping needles is not permitted without special authorization from EHS. The most common sharps injuries involve recapping needles. Occasionally, needles may be present in common areas of the campus, such as restrooms. Never pick up or touch needles unless trained and authorized. During normal business hours, report needles and sharps found in public areas to Environmental Health and Safety for further instructions. After normal business hours, contact campus police using the non-emergency number to report needles and sharps found in public areas. For additional information, please contact Environmental Health and Safety. To receive credit for this training, complete the test with a score of at least 80%. For questions or assistance, contact EHS.